Ladies, do you want to maintain a healthy vagina? Concerned about smelling bad down there? Want to lower your risk of yeast infections or bacterial vaginosis? Well, this video is just for you. I'm going to share with you 10 best feminine hygiene tips so that you can properly take care of down there. So before I get into the 10 best feminine hygiene tips, I think it would be important for me to share a couple feminine facts with you. So first of all, your vagina and vulva are not the same thing. Often women tend to call their vulva their vagina, or their vagina their vulva. They're two separate things, although they are connected. The vulva is actually the external parts of the female genitals. So that includes the mons pubis. That is the pubic area where your hair, your pubic hair, would grow. You have the labia majora, commonly known as the outer lips. And then there is the labia minora, known as the inner lips. And then, of course, we have the clitoris, which is equivalent to the penis. This has the sensitive nerve endings that can get stimulated and aroused during arousal, intercourse. So in addition to those parts, you would also have the urethral and the vaginal openings, along with the anus. So what you're seeing there are three openings. Urethra at the top, so this is where urine would exit, the vagina, and then the anus. So the vagina is really an opening. It is an internal opening that leads to the cervix and the uterus. So we're seeing the female reproductive system here. So obviously these are the inner organs that we cannot see from the outside. So the vagina is an actual opening. It's a canal. So the purpose of the vagina is to, first of all, shed menstrual blood that is released during the period. Secondly, to receive the penis during sexual intercourse. And thirdly, it provides a passage for the birth of a baby. So those are the three roles of the vagina. So just keep in mind, your vagina and vulva are not the same thing. Okay, with that being said, let's go on to the next fact you should probably know. Your vagina should actually be acidic. Healthy bacteria flourish in the vagina at the right pH balance. So you're going to hear me talking a lot about pH balance as I go through some of the feminine hygiene tips, because it's important to make sure that your vagina is kept at the right pH. So the pH scale just shows how acid or alkaline something is. So the lower the pH, the more acid the environment is. The higher the pH, the more alkaline. So your vagina, you don't want it to be too acid, and you certainly don't want it to be too alkaline, because this is going to disrupt the bacteria and create an environment for bad bacteria. So it's disrupting the environment for the healthy bacteria that is needed to keep your vagina working in good order. And if we have the good bacteria being disrupted, it creates an environment for bad bacteria and fungi to come in and grow. So we don't want these bad microbes coming in and taking over. So that is why it's important to make sure that the pH balance of your vagina is maintained. So that is normally between pH 3.5 to 4.5. So anything lower than that isn't good, and anything higher than that isn't good either. So we're trying to maintain a good pH balance. So it is when your pH balance is offset that you run the risk of facing common feminine problems such as vaginal odors, vaginal dryness, vaginal discharge, vaginal itching, yeast infections, and bacterial vaginosis. So do keep in mind that it is normal to have a natural vaginal odor. You don't expect it to smell like flowers. And it's also normal to have vaginal discharge. It would vary throughout the menstrual cycle. So sometimes you may see more discharge than other times. Like for instance, during your ovulation period, your fertile period, you may see the discharge looking a little more like the egg white consistency. So your discharge would vary throughout the cycle. So a normal odor and normal discharge is fine, but obviously when it looks a little weird or smells extremely strong and fishy, that is when the concern should arise. So what I'm going to share with you are 10 tips to help you prevent these things from happening. So first of all, the number one tip is to stay hydrated. Taking in as much water and keeping yourself hydrated helps to flush out toxins and bacteria from the body, first of all. And when you are dehydrated, you would notice that you produce strong smelling urine. So the more dehydrated you are, the stronger, the more concentrated your urine is going to be. So your urine has in urea, which is similar to ammonia in a sense. So the smell is going to be very pungent, very strong. So that can contribute to the smell sometimes down there. Now, aside from that, dehydration can also lead to vaginal dryness, and sometimes that can lead to itchiness. So it's very important that you make sure you're taking in sufficient water on a daily basis. So keeping hydrated is the first tip I have to share with you. Secondly, make sure you take showers regularly, at least twice a day. This is important to keep down there clean and fresh. So you want to be able to wash away any sweat, any dirt, menstrual blood during the period. All of these things trap odors. So if you're concerned about smelling funny down there, make sure you take a shower regularly. Now, please note, you don't want to be washing down there with harsh soaps. So it's always good to have natural, gentle, unscented soaps to be used in the pubic area, so around the vulva area, but not in the vagina. Only use water to wash around the vagina. Remember, the vagina is the opening, so you don't want to be washing inside there with harsh soaps and chemicals. So the key point here is to just make sure you're keeping down there nice and clean. Third tip, no douching. Now this is a very bad practice. For some reason, people think that you need to clean out your vagina to make sure that everything is nice and fresh. But actually, this is not the case because the vagina is self-cleansing. It cleans out itself on its own. So douching can actually disrupt the natural pH balance and get rid of healthy vaginal bacteria. So when the healthy vaginal bacteria are out of the way, that makes room for the bad bacteria, the bad yeast to come in and take over, hence causing the risk of vaginal infections. And douching can also cause irritation and burning. So you do not want to be releasing any liquids, whether it's water or vinegar, anything like that. Nothing like that should be going up in your vagina. So keep in mind the vagina is self-cleansing. The fourth tip, you want to keep down there shaved regularly. So it may be shaving, waxing, whatever it is to remove hair so that you don't have hair growing too long, because long hair is going to trap sweat and dirt and hence produce the odors. So it's important to keep that pubic area trimmed low. Now you don't want to be shaving against the grain. You want to shave along with the grain of the hair to prevent ingrown hairs and irritation. And you can use a shaving cream, something to give it some slip lubrication as you're shaving. So shaving cream, moisturizing soap, or even conditioner if you don't have shaving cream. But the key point is to make sure down there is kept groomed, well groomed. You don't necessarily have to completely remove every last bit of hair because there's a reason hair is growing down there. It serves some form of protection to that sensitive area down there. So yes, some people may prefer to have it clean shaven, no trace of hair, but ideally you should keep a little bit down there. But the main thing here is to keep the hair trimmed low. All right, let's go on to point number 5. So you want to make sure that down there is kept dry. After showering, it's important to dry your pubic area gently. And then you don't want to be keeping on wet garments for too long. So like if you went for a swim, you don't want to have that swimsuit soaking wet for too long. Yes, we know sometimes you may air dry on the beach or whatever, but keeping on wet garments for too long is not good. And then also during the period, it is extremely important that you change your pads and tampons regularly. So every 2 to 3 hours or so, or based on the flow of the period, because obviously if you have a heavy flow, you may need to change it more often. But the key point here is that moisture and blood create a breeding ground for yeast and bacteria. So this increases your chances of infections. So you want to make sure you're keeping down there dry. The 6th tip is to wear cotton underwear. Now, cotton is a breathable fabric that dries easily by allowing more airflow. So it is going to provide that airflow that is going to prevent sweating, and less sweating, less odors. So you want to reduce the wearing of, the fancy underwear that looks really nice, spandex, silk, satin, seamless underwear. Those are good for sometimes, maybe special occasions, but it should not be worn. Those type of underwear should not be worn on a regular basis. So it's always best to go for cotton underwear. So it's breathable, it allows more airflow, so therefore it can dry faster, moisture will not be kept too long down there. That is the whole point there. So wear cotton underwear. The 7th tip is to make sure you're wiping correctly. The right way to wipe is always to wipe down there from front to back. The wrong way to wipe is wiping from back to front. So clearly after you have defecated, the fecal bacteria in the feces, the stool, can easily be transferred from the anus to the vaginal area if you're wiping from back to front. So that is a huge no-no. You want to make sure that you're wiping from the front to the back to avoid the risk of infection. So both for the vagina as well as your urinary tract. So make sure you're wiping the right way. The 8th tip is to ensure that you are not using fragrances on anything that you're putting down there. So avoid soaps and feminine products with any kind of scent. So we're talking about feminine wipes, panty liners, sanitary napkins. Avoid buying these products that have scents because fragrances can cause irritation and they can also disrupt the natural pH of the vagina. And normally when you have fragrances is an extra chemical that's pretty much added to the product, and that is not very good for down there. So you want to make sure that you are avoiding fragrances in your feminine products. Tip number 9, urinate after sex. Now, urinating before and after sex is important because it's going to cleanse the urethra and reduce urinary tract infections. So we know the urinary tract, the urethra, that's separate from the vagina, but they're very closely located. So the concern really is that any bacteria that may be present on the man's penis during sex can transfer to the woman's urethra since they are closely located to each other, the vagina and the urethra. So that can pose a risk of a UTI. And you also want to keep in mind that semen is slightly alkaline. So during sex, the pH of the woman's vagina temporarily rises to create a more alkaline environment to protect the sperm and encourage fertilization. So this alters that pH balance, which should normally be acidic in the vagina. So sometimes it is good to consider using a condom, which can help prevent that change in the pH balance. All right, the next tip and the final tip would be to take probiotics. So probiotics help healthy vaginal bacteria to flourish. So when we're talking about probiotics, we're talking about good bacteria. And sometimes you may hear this more related to your digestive system. So like taking yogurt, it's good for the digestive tract, but it also helps in maintaining the correct pH balance of the vagina. Probiotics are also recommended for after taking antibiotics, because we know antibiotics can clean out the bacteria, both the good bacteria and the bad bacteria. So using a probiotic would be helpful to get that good bacteria back, and then also maintaining the balance of the vagina, as well as preventing urinary tract infections and improving digestion. So you can see there's a lot of benefits to taking probiotics. So those are my 10 best feminine hygiene tips for you. So if you notice anything weird down there, like for instance, consistently experiencing strong smelling vaginal discharge, white or yellow-green vaginal discharge, burning, itching, redness, swelling in or around the vagina, pain or discomfort during sex, pain during urination, bleeding between periods or after sex or after menopause, these are signs that you may need to go and see your gynecologist. So don't hesitate to see your doctor. So hopefully you found this video helpful. Thanks for watching, and feel free to watch this next video